A lot of people ask about the actual procedure when we do implants. Now, here at Just Smile, we use Noble Clinician software, which basically is a 3D imaging software. What we normally do, and a lot of our existing patients know this, that when we're ready to actually prepare for the treatment planning for an implant, we send the patient for a CT scan of that particular area. That comes in to us, then will be fed into the software, and from then on that recreate the 3D image of the skull of that particular part. And then what I normally do is just go through there, measure, and decide what kind of implant do we put in there, what angle, what length, and literally doing what we call a kind of digital surgery, if you like. And once we're happy with everything, we move on to the iPad, where I can take it with me, show the patient at a separate appointments, okay, this is what we have to do because of such and such. And when we have an agreement, that iPad, believe it or not, will actually control the device that puts the implants in as well. And the whole aim is not only to impress the patient, but actually make sure that we are that accurate and that delicate about the procedure that we're providing, so we end up with the best product that we can get. On the screen here, what you can see is a 3D image of an implant site. And here I've already placed an implant there, but could imagine that we had nothing in that area here. So what I normally do, as you can see, the slice will move and will show me particular sides of that 3D image. And here you can see the tooth in the bone itself, and when we move on into an empty space, it will look like that. So that empty space here, we don't know from the outside how wide, how long. In this particular area you can see the sinus. These are all important parts of anatomy that we have to measure and know about before we can go ahead with any implant placement. Now, when we move on forward, you can see here the implant or cross-section of an implant that we put in. So I know exactly how long that implant, how wide it is, where is it exactly. If I don't like, I can simply just move on and change things around it. And you can just choose the optimum placement. Then that could be transferred to the patient's mouth. So we know that I'm not going to go this way, I have to go that way, and that angle is measured. And once you do that, you can transfer that onto the iPad. And on the iPad, I can do this for demonstration of what we can do to the patient, as well as actually using the iPad to control what we call the micromotor that places the implant in there. And you can simply go ahead and choose on to go like that. And you can show the patient almost like an X-ray vision of the area, and I can move on to which area that I can see, and then I can just go ahead and click on that and show the patients where the implant is going to sit and exactly at what angle, and if there are any limitations, what are they, or precautions. And that will make it easier for both of us to understand what we have to do, and from then on, when we have an agreement, we move on into actually doing the procedure itself.